Mechanical ventilation has evolved over the past years. It has become a complex task with the application of scientific principles and precise measurements of a variety of parameters that are required for adequate care of the patient on the mechanical ventilator. Prior to the challenging of the competency-based objective, the student is encouraged to review the respiratory anatomy and physiology and mechanical ventilation theory as it relates to pressure scalars, compliance, resistance, elastic and non-elastic resistance as a theory component of the competency-based objective will be used. It is also strongly recommended to familiarize yourself with the capabilities and limitations of the particular ventilator on which the competency-based objective will be challenged. Static compliance is effective tidal volume all over P plateau minus PEEP total. Because it is a known volume over a known pressure, this must be performed in volume-oriented ventilation, and the patient must have a true plateau using an inspiratory pause and a total PEEP using an expiratory pause maneuver with no patient efforts noted. During the preparation and monitoring of the static compliance maneuver, the data for the airway resistance calculation may also be sought. The peak inspiratory pressure minus the P plateau, all divisible by the flow in a constant flow waveform pattern in liters per second, may be obtained. Verify, interpret, and evaluate the physician's order if appropriate or where policy and procedure dictate. Use aseptic technique throughout the procedure and thoroughly wash hands at a sink or with an approved alcohol-based product prior to the start of the procedure. Identify the patient, yourself, the department that you represent, and your role as a respiratory therapy student at NBCC SJ. It is also at this time that you should explain the procedure and confirm patient understanding as appropriate. Implement the procedure and ensure patient safety and comfort by monitoring using the bedside monitors. Where possible, do an expiratory pause maneuver, followed by an inspiratory pause maneuver to ensure that gas trapping inadvertently does not occur during the procedure. Ensure the inflation hold is set to the off position or an appropriate value as ordered by the physician or as warranted by the patient's condition. Inform the patient that the test is over and record the results on the ventilator flow sheet or according to site policy and procedure. Inform other personnel as appropriate, including the preceptor to whom you are assigned. It may seem that the theory and the skills associated with pulmonary mechanics are many and varied. By reviewing this competency-based objective video and bedside practice, you should become competent and able to perform this bedside practice.